The Delta variant, what you need to know. As a frontline physician, my patients are asking, what's the deal with the Delta variant? How is it different? How dangerous is it? And do our vaccines protect against it? Let's talk about all that. The Delta variant is the fourth variant of concern identified by the World Health Organization, and it's quickly becoming the dominant variant across the world. It was first identified in India, and by April had overwhelmed the Indian medical system. Since then, it's made its way into many other countries in Southeast Asia, crossed over into Europe, where it makes up 95% of cases in the UK, and is now in the US and Canada, where it's also becoming the dominant strain. But how is it different? The Delta variant has specific mutations in the spike protein of the coronavirus that enable it to bind to our cells more efficiently. This means that less of the virus can infect us, and infected people likely carry more of the virus around. As a result, it spreads about 60% more efficiently than previous variants. But does it affect us differently? All novel coronavirus infections share many similarities. But data from the UK, where people used an app to track their symptoms, suggests that the Delta variant is more likely to cause headache, sore throat, runny nose, and fever, and less likely to cause those traditional COVID symptoms like cough and loss of sense of smell. But unfortunately, studies also show that the Delta variant causes more serious illness, with about twice the chance of requiring hospital care compared to the Alpha variant. So not only does it spread more easily, but it also makes people sicker. Now for the good news. Studies from both England and Scotland showed that our vaccines work very well against the Delta variant. 2 doses of an mRNA vaccine like Pfizer are between 80 to 90% effective, and 2 doses of AstraZeneca are about 60% effective. That's pretty good, but the problem is that 1 dose of either of those vaccines is only about 33% effective, which means in countries like Canada, where most people have only had 1 dose, there's nothing more important to stop the spread of the Delta variant than getting that second shot. But there's more good news. If you're vaccinated with both or even just 1 dose, even if you do get infected, you are very unlikely to need to go to hospital. Protection from hospitalization is 96% after 2 doses of Pfizer and 92% after 2 doses of AstraZeneca. And even after 1 dose, protection is 94% with Pfizer and 71% with AstraZeneca. But what happens if you mix and match vaccines? For example, what if you had an AstraZeneca vaccine for your first shot and are being offered an mRNA vaccine like Pfizer or Moderna for your second shot? Well, the concept of mixing vaccines is nothing new. In fact, it's been studied extensively in developing vaccines against Ebola, tuberculosis, and even HIV. And because each vaccine stimulates a slightly different immune response, protection may be even stronger. Early studies from Europe using an AstraZeneca shot followed by an mRNA COVID vaccine do suggest a stronger immune response than 2 shots of AstraZeneca. So it's very possible that the protection you get by mixing vaccines will be stronger than the protection from 2 shots of AstraZeneca. But what if you're being offered the Moderna shot? Does that protect as well as the Pfizer? Well, both of these are mRNA vaccines. They both use the same part of the coronavirus to trigger an immune response, and trials so far have shown nearly identical results. So for all intents and purposes, we should think of them as 2 brands of the same product. It's like you're going out to buy a new black suit and you're choosing between Zara and H&M. They both look good, but the cut's a little different. At the end of the day, though, they both get the job done. And even if you wore the Zara blazer with the H&M pants, nobody would notice. It's the same thing with Moderna and Pfizer. Either vaccine is fine, and mixing and matching is fine too. The Delta variant is here, and vaccination is now more important than ever to prevent that 4th wave. If you haven't gotten your first shot, it's time to go out and get it. If you're waiting on your second shot, it's also time to go get it, and it doesn't really matter which vaccine you had for your first shot. What's more important is getting that second shot, no matter which vaccine, so you're safe from the Delta variant.